Good morning, I'm Amy Shuckley and Chair of the Tulare County Board of Supervisors, and I'd like to welcome you here today to our joint press conference convening all three hospitals and medical organizations who are working tirelessly on the front lines providing medical care to the citizens of Tulare County during this ongoing pandemic of COVID-19. We have today Sierra View Medical Center, Kauai Health, Adventist Health Central Valley, and Tulare County Public Health. And we're here today because, unfortunately, Tulare County is again in another serious situation. We are experiencing another COVID-19 surge. Cases are being driven by the Delta variant and is once again overwhelming our hospitals with very sick patients. Today you'll be hearing directly from hospitals, the frontline doctors and nurses face to face with this awful virus that continues to be making people across Tulare County severely ill, to the level that they are needing to be hospitalized. But before we get to our hospital representatives, let me share the current situation of COVID vaccination rates in Tulare County. Currently, only 35.5% of Tulare County is fully vaccinated. Looking further, 41.8% of Tulare County residents have received at least one dose of the vaccine. Over time, in 3 to 4 weeks, we will see that 35% of fully vaccinated rise to 41%, if everyone completes their vaccination series. So if you've got that first dose of the 2-shot series, please get your second dose and complete your vaccination process. Now, understanding not everyone is currently eligible to get a COVID vaccine because of their age or certain medical conditions, looking at our population who is age eligible, currently 51.2% of Tulare County residents age 12 and older have got at least one dose of the COVID vaccine, and 43.5% of those eligible are fully vaccinated. Although these numbers are promising, unfortunately Tulare County is behind and lagging in vaccination rates occurring in other parts of California, and because of this, our healthcare providers and hospitals continue to suffer. Our current surge in COVID cases is being driven by the Delta strain, and it's spreading rapidly and causing a surge in Tulare County, but across California also. Last week, over 87% of COVID-positive specimens were genetically sequenced from Tulare County were identified as the Delta variant. To date, our Tulare County Public Health Lab and other labs in the county have identified approximately 93 specimens of the Delta strain in Tulare County. Know that these have been identified through genomic sequencing efforts, and be aware that not every positive COVID test is genetically sequenced for identification of various strains. So we know that there are more Delta variant cases out there circulating in our community. The Delta strain is much more infectious than the original strain of COVID-19, and while some people who are vaccinated may still get infected with the Delta variant, the COVID vaccine does provide strong protection against getting seriously ill, preventing severe disease, and the vaccine has shown to prevent death. According to the CDC, unvaccinated people are 25 times more likely to be hospitalized for illness from COVID-19 than those who are fully vaccinated. Data shows the vaccines are working. They are proven safe, and they are effective at preventing severe illness and death from COVID-19. But I'm a politician, so if you don't believe me, let's hear from the medical experts. So first off, we have Donna Hefner, the CEO from Sierra View Medical Center in Porterville. Donna?
Thank you, Amy. I'm Donna Hefner, the President and CEO of Sierra View Medical Center. I am also a registered nurse by training. I'd like to provide I'd like to talk to you about 3 things. I'd like to give you a current state of our organization, and I'd also like to give you an update on our visitation as well as our vaccination rate of our healthcare workers. So currently today, we have 14 positive patients who are positive with COVID. We have 7 patients that were pending results as far as their status of positive or negative with COVID. So that gives us 21 patients in our isolated unit. None of our patients are in the ICU. All of our other patients in the ICU are other critical natures, but not COVID related. So currently, we are working with 13 patients that are unvaccinated and one that was partially vaccinated. So in regards to a recent change of today, we have a new visitation process that actually came out over the weekend. So we've been quickly trying to get this update to our community. So I'd like to share with you some of those changes. This effort is to protect our patient population as well as our staff and as well as our community. So currently we have gone to no visitation in the ER. So one would ask why. Really, it's a space issue. So we'd ask that for the time being that we will have no visitors in our ER. As far as visitors visiting the center, we've had to ask for your vaccination status, or if you are not vaccinated, we ask that you bring a test result, either that is approved, and that has to be done within 72 hours prior to your visit. The exemptions around visitation are still in place around in the life. And on those in the life situations, we will have 2 visitors that may or may not be vaccinated and may or may not have proof of that. So we are, based on timing, we will be welcoming them in. I just make a note here that all visitors visiting our organization will be wearing a surgical grade mask issued to our visitors upon entry. I also like to share with you 2 other exemptions have to do with parents accompanying a minor. We recognize that emergencies happen and it's really unreasonable to be able to get that adult to be able to get vaccinated. As well as the second part of it is in regards to dependent adults that are needing to have a caregiver with them. And those that come in active labor, we cannot anticipate those sometimes spontaneous events around labor. So we will have been working through a process today with getting our visitors accompanying those patients a test result, while they enter the organization. So that's a little unique. We haven't done that before, so please bear with us as we work through the process there. We are going to go to no visitation after 9 p.m. Just in regards to helping manage the and ensuring that our patients do get their rest as well. As far as an update on our healthcare workers, I met with our leadership team on Monday. The state officer issued this mandate last Thursday, so we're quickly working through in regards to the implementation of the elements around vaccination of healthcare workers. I'm happy to report to you that we're at a 65% compliance. We're up even percentage of yesterday, and one would ask, why is that? It's really around obtaining an unknown status of our 34% is really around, I say, of our healthcare workers is an unknown status. I wouldn't classify them as unvaccinated, so we're working through the process there in regards to determining that. Now, based on the mandate, there are 2 exemptions. One is a medical exemption, and the other one is a religious belief attestation. And so we have put in processes, and we're just in the beginning phases of getting those rolled out, and we will be having that. The timeline to this is we have to have this all completed by September 30th. So we have a pretty short time frame, but we are working through this issue with our leadership team. And then the last thing I'd like to just share with you is around the challenges. We've learned a lot through this pandemic, and we've been unwaverly in regards to our processes, although things seem to be changing throughout this last year and a half. But one thing we have stayed consistent with is the reporting out to our community in regards to our status. We were very happy as an organization when we had 1 positive COVID patient. So what does that mean to us? We're constantly adapting to the volume, meaning that we've had to, when we surged up, we actually started our unit in our telemetry unit, which is on the 2nd floor. And as we quickly saw the surging going beyond that bed capacity, we moved it up to our 3rd floor where we had a 22-bed unit that we could isolate. So we've done this last year several times, and so our staff although doing a transition like that is a lot of extra work on our staff, we're going those extra miles to protect our patients as well as our staff. And so the things that we're still really having issues with, believe it or not, is supplies. And that changes. To this week, it was, Sunday night was all about blood sugar test strips. Some of these things we can't anticipate, but based on that surge, and I think a lot of that was due to the rapid surge starting the last week and a half. So we are constantly monitoring those supplies and procuring those supplies, so that's really another issue. The third issue that is a little challenging is around our length of stay. As we saw through this pandemic, our patients that are positive with COVID have longer length of stays. It's no longer the 3.5 days and you're going to your safe discharge. It's that planning of what your continuum of care is going to be even after we get you out of your acute care state. So I just end with that we are here and committed. The other issue that we're dealing with is staffing. And we have seen a shortage of staff, and that is something that we're trying to work through, as many other organizations are throughout California. So I thank you for your time, and I'm open to questions at the end. Thank you.
All right, thank you, Donna. Next up, we have Carrie Nowesky, who is the Chief Nursing Officer with Kuya Health.
Thank you, Amy. Thank you for having us here today and giving us this opportunity to share our status reports and situations that we have in the healthcare in general for our county. So I want to share with you a picture of what's going on in the hospital, because that's where we're seeing the biggest impact from COVID, and then just share a little bit more about what's going on with our teams and our plans and what it'll look like as we go into this next surge of COVID response. Currently in the hospital, we have 64 inpatients who are being treated and have COVID. When I look back over the last month and a half, 75 to 80% of those are primary diagnosis of COVID. So it is not another diagnosis and then COVID too. It is being treated for COVID and COVID-related infections. We have 11 of those patients who are in ICU. All of those are related to COVID. 10 of those patients are unvaccinated. And I share that because I know that is a question that comes up frequently with our community. And I want to stress that the hospitalizations are most often patients who are not vaccinated. That does demonstrate that our vaccine that we have is effective in preventing serious illness and hospitalization when people do contract COVID. This is hopeful for us, and I do recognize the value of that vaccine and the value of choices that we want patients to make. 3 weeks ago, we were at 10 patients in the hospital with COVID, so we have seen the biggest increase so far in COVID patients that are hospitalized in this current surge. We are concerned that that number will start to go up. What we're doing to plan for that and address that is beginning to identify areas where we can surge our patients again. We did that in December, January, where we were doing ICU in a step-down unit, and we were doing medical surgical levels of care in our endoscopy and procedural areas, as well as backups in our emergency department. We are planning for that again. We are training nurses and retraining nurses to do ICU level of care, because that does take more resources. We do anticipate that surge will continue as patients come in and are sick and need that level of care. We want to provide that to the community, but what that does do as we take up critical care beds with COVID-related admissions, it does make it harder for caring for other people that also need ICU level of care. In anticipation of that, getting ready for that again, and we will keep the community informed of what our ICU capacity is as we go through. We also have employees and medical staff that are impacted, as Donna shared about, with the mandatory vaccination and that public health order that came out recently. As of this week, 77% of our medical staff are fully vaccinated. 55% of our healthcare staff are vaccinated. We continue to work with our healthcare staff on the importance of the vaccination and sharing with them details on how to meet this new mandate by September 30th. We're sharing with them the exemptions as well and giving them the options that they have a right to through this mandate for medical or religious exemptions, and making sure that they have access to that information. We think it's important that our team members are just as informed as our community when they are making that decision about the vaccination. We've also experienced the changes with the visitor policy. That was also a state mandate to help reduce the risk of transmission of COVID in our state, as we are continuing to see the rise of numbers of COVID cases. Effective today, we are requiring, as visitors come in, that they demonstrate a proof of vaccination, which could be a picture of their vaccine card, their actual vaccine card, the QR code that's available through the state, any way that we can visualize that card or that evidence of the vaccination. We are not keeping copies of that. We are not logging that, other than to demonstrate that we did check and validate that there is a vaccine or the negative COVID-19 test within the last 72 hours. In anticipation of people wanting to do the more COVID-19 testing because of this change, we've increased our testing capacity at our urgent cares, and so we can try to get people in and help them with being able to see their loved ones and meet that mandate. That may or may not happen in the same day, though. And I ask that people recognize that this increased demand and these surges are putting another strain on all of our clinics out there who are providing COVID testing, that we will see that slow down again. And we experienced that several times last year, and it really is the resources available to meet the demand. And shifting resources is not as easy when they're all being needed in the various venues. We need them in the clinics, we need them in the hospitals, urgent cares, and emergency departments. We need them for vaccination administration and for testing. So we have to put the resources where the most urgent needs are, and right now for Kauai Health, that is in patient care, in our clinics, and in our hospital. So for our visitor policy, the change from last week to this week is, instead of one visitor per day, we are allowing one unique visitor for the entire stay of the patient. And that is important, again, on the strain on those resources. We don't want more testing going on, and we don't want to have to introduce more people into the environment than necessary. So one unique visitor per patient. We are still allowing the emergency department to have visitors. We have one visitor once a patient is in a room, not in our waiting rooms. We just aren't able to separate and social distance enough in our ED waiting room to allow for that space. But once a patient is in a room, we can allow one visitor in with them at this time. The state gave us a great clarification in the visitor piece that really helps our pediatric and labor and delivery patients, as Donna shared. So we are able to have pediatric parents go with their child, or the guardians go with the child without evidence of vaccine or without evidence of COVID-19 negative test. Same for our labor and delivery. And then similar exceptions apply for Kauai Health, that the end of life, imminent critical needs, unstable condition, we will bypass the COVID-19 test or vaccine rule so we can get family members to the bedside of their loved ones. So, as we go through, I do want to just put out there that this vaccine did make a significant impact when we saw it come out in December, January, and as it became more available for our communities, we continued to see a decline in hospitalizations and even rates of positivity. It did have an impact. I do support getting back to normalcy and getting back to normal routines and activities. The vaccine is an important part of that. What I would ask people to do that need more information is to really talk to your primary care provider. there's really no other good source other than your doctor who knows you to help you with making that decision. And I want to just really stress, make the decision for yourself, but get your information from someone that you trust that knows your health history, and try not to use the different things that you may come across for different sources that are maybe not vetted through social media right now, because there is a lot of information out there and your doctor does know you the best. And I would just ask that you consider taking that route and look again at the vaccine now that it's been out for a while and what it can do to help us with reopening and returning to normalcy. Thank you again, and I will be available for other questions.
All right, thank you, Carrie. Next up, we have Dr. Gervinder Carr, who is the Chief Medical Officer with Adventist Health Central Valley.
Hi, good morning, everybody. Thank you for giving us a chance to talk about what we are going through with this new surge that we're facing again. This has been a humbling time for most of us healthcare workers. We have gone through some serious surges through this pandemic, and it doesn't seem to end. We're seeing that again now. Delta variant is causing a new wave of patients coming in. We, for us in Adventist Health Central Valley Network, have seen that number triple over the past few weeks. So as of today, we have 63 patients in the Central Valley Network. 4 are in ICU, 53 in Hanford, 7 in Tulare, 1 in Selma. Again, we worry, how are we going to continue to care for these patients? Because healthcare workers are exhausted. We know our healthcare personnel have been through a lot. They are tired, they are burnt out, they are worried, and some of them are getting sick. And so I again appeal, vaccines work. This is science, it's proven science. We have lots of evidence to say that vaccines are safe and they're effective and they're preventing hospitalizations and they're preventing deaths. I cannot make a bigger appeal to us, to our communities, to please go out and get your vaccine. If you have specific questions about your healthcare, about your specific health issues, please reach out to your physician. Have them give you the advice on what works for you, which vaccine to take if you need, but get the vaccine. I was first in line to get the vaccine as soon as it was available, and when the booster or the third dose is available, I'm going to be first in line again. We should not take this risk. We have seen patients who have struggled to breathe on ventilators. It's not something we want to play with. It's not something that we can take a risk again. So this is my humble appeal. Right now, within Kings County, about 30% of the folks have gotten the complete vaccination series, and 36% have at least partial vaccinated. We already heard Tulare County numbers. I also want to make sure that we are aware that we are seeing about an average of 69 new cases per day in Kings County, and that's, again, very quickly, rapidly, infection rate is rising. As Supervisor Amy Shuglin mentioned, most of the genetic analysis has shown that these seem to be Delta variant, and that is 1,000 times more infectious than the original COVID virus. So this is very important for us to know that the infection spreads much rapidly when it's a Delta variant. In terms of our own hospital, we do have the same mandates that everybody else talked about here. We are putting in effect the new Visitation Guidelines, which mentioned as of today that the any visitors have to have a negative COVID test within 72 hours, or they have to have a proof of vaccination. Again, we have same exemptions to that, which includes end of life, any patient with disability or cognitive impairment, if there's a child or labor, and a surgery patient. Other than that, I also want to encourage that school is reopening. Any children above 12 years of age, please go get your vaccine. Parents, please get your children vaccinated, because that's another area that we are worried that the infection rate might rapidly rise. As you know, we are seeing hospitalizations among children now. With the original COVID variant, we did not see as many children hospitalized, but now we're starting to see them in the hospitals. Again, my humble appeal, please get your vaccine for your children. This is going to save the children, this is going to save the adults who care for them, and again, a very important step for us to take. Another important thing I want to mention is we also are under the same mandate for our healthcare workers that CDPH has announced as of on August 5th. So as of September 30th, we are going to be requiring all our healthcare workers, whether they are direct patient contact or indirect patient contact, to have full vaccination proof. Certainly there's a lot to be done. We have very short timeline, but we are completely in line with what the mandate requires. And there's going to be some, we again respect our employees and our associates' choices. And so if they do meet medical or religious exemption, then they will be applying for it. That application will be available for them, and they will have certain deadlines to meet to be able to get an exemption if they do are eligible for that. I think that was my main area I wanted to cover today. I'm happy for more questions.
All right, thank you, Dr. Carr. At this time, I am going to go through some questions that we have had submitted prior to this press conference and also from some online. Some of them have actually been answered as folks have been talking, but I will still ask them so we can get a little focus. What percentage of hospitalized patients are unvaccinated? And Carrie, I think you said just 1 out of the 11 in ICU was unvaccinated?
That's correct. We had to do more of a manual look at the vaccine because it wasn't a field in our electronic record. We've now built a field in our electronic record to capture vaccine status so we can more easily pull that information and share it. But when we did a manual look back to July 1st, 84% of our inpatients were not vaccinated. And then we will get more timely, real-time information, especially now in August and September as we anticipate numbers going up, that we can share with you.
Okay, the next question is the COVID vaccine totally approved by the FDA yet? And that is, it is not, but my understanding is the Pfizer is close to getting full approval? I'm seeing a yes from Adventist folks.
It's close.
Dr. Carr?
It's close.
It's close,
Yeah.
yes. But it does, they all have emergency approval through the FDA. How many nurses, medical staff, and employees are vaccinated? Well, I heard Carrie say 55% of the healthcare employees and 77% of the medical staff were
Correct.
at Kauai Health.
65.
Donna, 65% at Sierra View.
For Adventist Health, the associates is about more than 50%,
More than
and the medical staff is close to 80%.
Close to 80% for the medical staff. Okay, thank you. Does Kauai Health recommend getting a COVID booster shot, especially for those who got the Johnson & Johnson?
So we are watching the research around the booster for the vaccinations right now, and if they do come out that there needs to be a booster for the Johnson & Johnson or any of the others, then all of the healthcare organizations will then work on making sure that that's available. The research is very split right now on the effectiveness with Johnson & Johnson, and we know that the more research that's done, the more information that we have. So right now we just see a lot of split between effectiveness with the Delta variant and not, and the amount of effectiveness. So we just continue to watch for that booster to become approved, and then we'll work with the county on making it available to our community.
Don't go far. No,
Okay.
sorry. You can probably hear me. Does Kauai Health expect to have the emergency department fully open to help handle an additional surge of COVID cases?
So as the community knows, Kauai Health opened up or completed construction on an addition of 24 beds to our emergency department, giving us a total of 73 beds available for care. We will be opening that on Wednesday next week, and then we will have that 73 bed capacity as long as we have staffing for all of those beds. That is a critical component with the number of beds, and something that when we started the construction several years ago, did not quite anticipate the changes in healthcare staffing that came about with this COVID pandemic. And I know the other hospitals are also experiencing the staffing crisis that we have in the Central Valley. But we are working on onboarding and both travel nurses and permanent nurses so we can open up all 73 beds. So the anticipation is within the next month to 6 weeks that we will be able to use all those beds.
Thank you. All right, do any of the hospitals anticipate another shutdown of elective surgery services? Carrie, Cahuilla Health, do they, just, you can let me know. if
So we will only do that if we start doing patient care, and we will do that on a week by week basis. But we start doing patient care in areas that are not designated for patient care.
Okay, and Donna, has any talk about not having elective surgeries?
No.
Not yet.
So yeah, we also assess on a week by week basis, and depending on how the bed utilization is going, we make those decisions.
Depending on, bed utilization and, okay, thank you. Are the hospitals performing outpatient procedures to unvaccinated people?
Yes.
Yes?
Yes.
Cahuilla, yes?
Yes.
Sierra View, yes? Adventist, yes. Okay. If the cases are up, then why are kids going back to school? Well, we have nobody here from the school district, but there is a mandate currently for the state that children going back to school are required to wear masks. That's really all I can answer on that one. How can we determine if vaccine cards are legitimate? Anybody? We can't. But we would hope that people do not fake vaccination records, because it's very important that we know whether you are vaccinated or not. This one,
The QR code is.
yeah, the QR code, yes. So if you do have a legitimate vaccine, you can go on to the California Department of Public Health and get a QR code, and I'll show you mine maybe in a minute. Is it possible to tell patients if they have the Delta variant? Dr. Minnick, can you answer that one for us?
Yes, so the test that determines the sequence of a variant, first of all, you can only sequence certain samples. It has to have enough virus material in it and be a quality sample to be able to sequence, so not all of them are able to sequence. Also, it's usually a 2 or 3 week later that a sample is sequenced. It's not part of patient care. The providers are to provide the medical care that a patient needs based on their presentation, not based on what sequence they may or may not have. And the test that is, the sequencing test is only approved for public health surveillance purposes, so it gives us an idea of what strains are out there, but it's not approved for as a clinical patient test, so we cannot provide that information to the patients.
Okay, I just want to show real quick, this is the my site here that I have saved in my phone, a digital vaccine record. I already set it up, so I just have to put in my code. That's better work. I'm not getting a connection. All right, I'll try it again in a minute. How many of the people in ICU got the vaccine? I know Carrie had already said out of the 11 that are currently in Cahuilla, 10 were unvaccinated.
One was partially,
Yeah, one was partially. You had 4, correct, in ICU?
none in
Oh.
ICU.
Oh, not in ICU. Just out of the 4 patients, 3 were not, and 1 was partial. And
So
Dr.
we
Carr?
have 5 unvaccinated, 5 vaccinated folks, and all of them are out of ICU on regular med surg.
Okay, a regular. They're not in ICU. Okay. Does the medical religious exemption from vaccination also apply to visitors to the hospital? And I asked Donna this earlier. Yes, but they also are requiring 72-hour test results for visitors if you're not vaccinated. Why is the vaccine being mandated for healthcare workers if it is not FDA approved? Because it saves lives? I'll answer that one. Would you like to add anything to that? Okay. Has the vaccine been tested on pregnant women?
Yes.
So
And
Dr.
as of
Carr,
today, yeah.
why don't you come on up?
So today, CDC came out with a recommendation that COVID vaccine has safety, a proven safety and efficacy for pregnant women through the research that has been done on pregnant patients. And so there is no risk for miscarriage as was feared in the past. Patients who are pregnant are safe to get their COVID vaccine. American College of Obstetrics and Gynecology had recommended this vaccine long before that. So they also had looked at the data coming out on the preliminary studies, and it was recommended for pregnant women to get it.
Thank you. How are we doing on time, Karen? Outside of vaccinations, are hospitals going to post how to help boost immune systems, or what would help people not get COVID so easily? Carrie, would you like to?
So I think that's been a message that we've sent out there pretty routinely through the last 18 months. And it's not anything that's necessarily medications or anything you can like that. It really is the hand hygiene and the mask wearing and the distancing and watching yourself for symptoms, staying away from groups if you do have any of the symptoms, the sore throat, which we maybe all have this time of year in the Central Valley, and checking yourself for a fever, just being extra aware of how you're feeling, what those symptoms are, and then getting tested and not being afraid to get tested to determine if you do have COVID or not. But it's really that extra vigilance on each individual and continuing with those measures. And I know people are tired, and we've had that sense of reopening, that we can go back to normal. We know that we can't go back to normal, but I know that for the mental health of our students and our communities, that we also are hesitant to lock all the way back down too. So the in-between would be keeping yourself healthy, rested, avoiding large crowds, not going out when you're sick, being aware of others that may or may not be sick, hand washing, wiping surfaces. All those things still come into play, even right now, especially right now with the Delta variant being more transmissible. Thank you.
Oh, hold on.
Oh.
How will you handle the shortage of nurses once September 30th arrives?
So I am remaining optimistic that we can work with our nursing staff and our whole healthcare team to work through the mandate, help them with the decision for vaccination. Like Dr. Carr said, the new CDC information today is very helpful in why some people are hesitant with deciding to take the vaccine, but just continuing to educate, as well as making the declination that the state requires for people that do need an exemption available to the staff, so that way they can have that choice based on medical or religious needs. We have been trying to hire and overhire. This is not quite the time of year where we have nursing students coming out of programs. That's closer to November when we start to see them wrapping up their programs, but continuing to facilitate onboarding of travelers, working with agencies to get exclusive contracts when possible, working with EMSA to get exemption for licensing is also a key factor in bringing out-of-state resources in. If it continues to surge across the country, we will be in a similar state to we were last year, with not enough nursing and medical staff to go around. And then we will have to ask our teams within our healthcare settings to work extra, which they are typically already doing, and moving non-bedside, non-clinical licensed professionals back to the bedside, which is something that we did last year that we would have to explore again too.
All right, thank you, Carrie. All right, I think it's gonna work now. So I put in my little code and I hit submit, and there is my QR code that shows that I do, this is actual proof of vaccination through the state of California. Is there an alternative for healthcare who refuse to get vaccinated? Yes, testing. I think it's twice a week now for testing. If you work in a healthcare setting and you don't have an attestation, then you will be required to be tested 2 times a week. Okay, with that, are there any questions from members of the press here in the room today?
I have a
Yes.
quick question.
Okay.
Jocelyn here with KC24.
Uh-huh.
I was wondering if hospital officials might be able to talk on what is different from this surge from the previous winter surge. Are there younger patients in the hospital, for example?
I think that was, yeah,
Sure, I can take that.
doctor.
Generally, our counties do serve younger patients, so if you look at the patient age distribution, we do have younger population in our county. So having said that, yes, this time around, we are seeing younger patients coming in and getting hospitalized compared to the last surge where we had much more elderly folks. Thankfully, I also believe that the vaccine acceptance was much higher in our elderly folks, which is keeping them out of the hospitals and much safer now. So we are seeing a lot more younger folks, and certainly if you have underlying comorbid conditions, that does put you at a risk of getting a much severe sickness or illness from that, which does land them in the hospital, and that's another trend that we're continuing to see.
Any other questions?
Are we hearing?
No, not
from-
you, not you. Go ahead, Brian.
Are we hearing from patients in the hospital right now or recently that are unvaccinated that are expressing regret about not getting the vaccine? And if so, what does that look like? What are those conversations like? And how hard is that for doctors?
I'm seeing heads shaking up and down. Yes, so doctor, or Donna, or you guys can.
Yeah, I can tell you from my own experience that I have had patients who have expressed their regret on not taking the vaccine when they should have or could have. And in fact, when they ended up on the ventilator or very close to being on the ventilator, they had expressed this emotional plea to their family members to go get vaccinated. Not only is it my personal experience, we've also witnessed it in many different news media, and certainly we have seen it a lot in other areas, but I can tell you for a fact because I've seen it at bedside, and that is the most heart-wrenching plea that really does hit you as healthcare workers, and that's where I'm coming from when I make this plea to our communities, because we have seen it over and over again. I would really urge people to not make the mistake of not getting vaccinated if you are eligible for it.
All right. Any other questions?
Got a question. Ben Irwin from the Sun Gazette. This is for Career Health. You mentioned the emergency department. We had heard that the plan was to close down 2 of the zones to open Zone 5. But I believe I heard you say all 73 beds were planning on being available. Which one is it?
So in the this week with the opening, without the enough staff, we will close certain beds down that we can't staff. But the hope and plan is in the next 6 weeks with the onboarding of travelers and with the new staff that are on orientation that we've hired in the last 3 months, that we will be able to maximize staffing and open all the beds throughout the day. So not next week when we open, but in 6 weeks' time, it would be our goal to be able to use all those beds because we have enough staff. If we don't have enough staff in the emergency department, then we do leave some beds closed in order to maintain ratios.
Okay, thank you.
Yeah.
All right. So with that,
Supervisor?
oh yes.
One last question. Even with testing 2 times a week, are rapid COVID tests still accurate for early detection?
Yes. I'm seeing doctor's head shake,
Yes.
nurses' heads shake up and down. Yes, so yes, they are. Thank you, Carrie. All right. Well, COVID vaccine, obviously we've heard today it is effective against serious illness and death. So if you have not done so already, please get vaccinated to protect yourself, your friends, your coworkers, your family. It's readily available throughout Tulare County with no appointments necessary. You can visit myturn.ca.gov or call 1-833-422-4255 to find a county-sponsored clinic near you. But again, across the street at Walgreens, I was there the other day, people were lined up for, and I remember when the vaccine first came out and there was a shortage, and how people were calling and begging to please, get in to get an appointment for a vaccine, and now we have an abundance, so I encourage you to do that. I want to thank Dr. Carr, I want to thank Donna, and I want to thank Carrie. I told Donna I'm tired of seeing her at press conferences. Hopefully one day we can go out to coffee without a press conference talking about COVID. So I just want to say thank you to all the frontline workers that are here and out in the community who are working hard at dealing with the newest strain of COVID. And that's it. Thank you.